Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This series is being done in partnership with BayCare's Winter Haven Hospital to help you, the community, learn more about our local physicians, as well as the important programs and services that Winter Haven Hospital provides to keep our community healthy and thriving. On today's episode, I have the pleasure to speak with Dr. Kenneth Essig. Dr. Essig is board certified in urology and is a member of the BayCare Medical Group here in Winter Haven.
Dr. Essig, thank you so much for coming on the show today. And I really like to start off this series by asking the physician a little bit about themselves personally. Where did you grow up and what was your journey like to come to Winter Haven?
So I grew up in Cincinnati, Ohio, born and raised there, did my medical school training there, and also did my part of my residency there as well as in Syracuse. In 1997, we came to Central Florida, to Bond Clinic, actually, in Winter Haven, where I worked for approximately 10 years. Then I took a slight foray a little bit north into Claremont and opened my own practice in Claremont for about 10 years as well. And then in the past 6 years, I've come back to Winter Haven and worked as an employee for Winter Haven Hospital, but also having my own practice, outpatient practice, but also seeing patients and operating at BayCare's Winter Haven Hospital.
Now, did you always know you wanted to be a physician, or was that a period of self-discovery?
Physician, probably yes. I don't think I ever really considered anything else. My dad was an obstetrician, and when I was a young man, I always had dreams of joining my dad's obstetrical practice. Then as I got through medical school and realized that that probably wasn't what I was best suited for, I came to realize that urology has some similar attributes to it, and that was more suited to who I was. And so I pursued a urology residency starting in 1988, and have been a urologist, board certified urologist since 2000.
So you said you relocated to Central Florida. Was that a job that brought you down here, or was it Florida being location and weather and everything like that?
Good question. So we had lived and done some of my training, as I said, in Syracuse, New York. In some ways, Central Florida and this area may have been an overcompensation for our 3 winters in Syracuse, which sometimes saw snowfall so significant that cars parked on the street couldn't be seen at the end of the day because they were covered in snow. So this was at least a compensation, maybe an overcompensation for those kinds of winters.
Well, we are the better for it. We will take any physician who is sick of that northern winter. So we certainly get a lot of inquiries down here because of that. So
nice to be there.
So, you mentioned that you have started your own practice, which also makes you an entrepreneur. And I always find that so interesting, especially from a Chamber of Commerce perspective, because you're certainly incredibly proficient and have years and years of training in medical, on the medical side of your career. What is it like to be a small business owner?
You're exactly right. So when we become physicians, we do 4 years of college. We do 4 years of medical school, and we do 6 years of training in our profession. So we are training and training and training to be physicians. Unfortunately, and I've been out for a few years, and I don't know if this has changed significantly, but unfortunately, we're not trained at all to run a practice or to run a business. So I always had that hope and aspiration that I could just fall into running a business and it would sort of run itself. Unfortunately, that wasn't the case. And I quickly came to realize that I was probably a better physician than a businessman. And there's a lot to running a successful business. And more myself and other physicians are coming to realize that if we focus on being the physicians that we are and have big businesses, whether that's BayCare or some of the other hospitals run our practices, we're all better off for it.
Well, and certainly the support staff that you're able to bring on your team and handle those customer service inquiries and the billing and all of those things that come along with that, it certainly helps out.
Absolutely.
So Let's pivot a little bit to your practice of urology. So talk a little bit about what leads a patient to come to see you. What are those common symptoms that you see within your office?
So I do adult urology. I don't do pediatric urology. That's really a very separate field. So anybody over the age of 18 can come to see me. And what we as urologists do is we treat the urinary tract, the kidney, the bladder, the prostate in men. So probably the most common thing that I do and see and treat is kidney stones. So oftentimes you'll see people who have pretty severe pain, and it's a pretty gratifying endeavor to be able to treat kidney stones, because it's something that you can treat very specifically, you can treat very quickly, and you can get people from being very, very miserable to very, very healthy in a relatively short period of time. Those are all reasons why I became a urologist, because I wanted sort of that instant gratification of making people better. Aside from that, we see a lot of men and women with urinary tract symptoms, which can include going to the bathroom too often, having men, especially older men with large prostates. We treat them for prostate issues. See a lot of men with erectile dysfunction and treat that. And then people with urinary tract infections or bleeding in the urine. I would say of what I just mentioned, that's probably about 80 or 90% of what I see. Also see some patients with cancer, be it kidney cancer, bladder cancer, prostate cancer, and that's also part of the practice.
How often should men be getting prostate exams? Is that, I know a lot about how often females should be getting mammograms, et cetera, and those types of things, but how often should a man be going in for regular screenings?
So it's controversial. It used to be everybody was encouraged to get them constantly and really every year. Now we've pared that back a little bit and said some men need it more often than others, and in some men they may not need it at all. So to that end, the American Urologic Association has sort of focused in on the men that are more apt to have problems with their prostate. And those are men between the ages of 45 and 70, certainly men who have a family history of prostate cancer. Those are the men that typically need to be checked usually once a year. There are some exceptions, and if the blood test and the exam is very, very normal, it can go to once every 2 years. And those tests can be done by the primary care physician. It doesn't require a visit with a specialist, but if there's anything abnormal, that's when we come in. But typically, men who are doing well, they're healthy, they're having no urinary issues, over the age of 70, it's now recommended that the screening with PSA blood tests and with prostate exams, if we look back at all the data and all the men who have been treated and haven't, that there's really not a significant benefit beyond the age of 70 to continue to get those annual checks. So not everybody needs everything. And this is one of those cases where we as physicians say, it's probably not necessary to keep checking your prostate your entire life. If you get to the age of 70 and you're doing well and you're healthy and you don't have any prostate issues, that's one of the things you can check off the list of things that need to be constantly monitored.
And that sounds like a conversation that a patient should first have with their primary care physician as to whether they're a candidate and how often they should be getting screened.
Correct. And a well-trained primary care physician is going to know those screening guidelines and know who needs and really who doesn't need, because we can always, as physicians, say yes and more is more, but sometimes we need to, as physicians, say, this isn't really something you need to focus on. And I think that's as much our job as physicians as it is to treat the people that need to be treated.
So you talked about some of the most common issues that people come in and those diagnoses that go along with those. What are the most common treatments for example, kidney stones? How do you treat a kidney stone?
So that's changed really within the past 5 or 10 years. We used to use that big shockwave machine that many people have heard of, where years ago, it used to be in a great big tub bath where we put people in a tub bath and you send a shockwave through the body into the kidney. And those broke up stones. And we still do that. That's called shockwave lithotripsy. It's a little more refined. But now technology has advanced so that scopes have become smaller and smaller and smaller, so much so that a scope not smaller than the head of a pen can be passed up the urinary tract while patient's asleep in order to see a stone and allow us to fragment it with a very, very small laser fiber. So we're doing a lot more of that. It's a little bit less traumatic to the kidney. We do both of those treatments, but percentage-wise, I would say within the past 5 years, we've done a lot more of these laser treatments. No cutting. Cutting used to be a really big part of kidney stones 25, more like 30, 35 years ago. But now cutting someone open for a kidney stone, I've been in practice now for 20 some years, and maybe 1 or 2 patients have needed to be cut open for kidney stones. It's really almost exclusively done in a minimally invasive way.
And is the recovery pretty expeditious with using the laser method?
Yeah, I mean, compared to having surgery where people would be in the hospital and not even getting out of bed for days, now with the laser, typically a person could come in with a kidney stone in the morning, and depending on availability of the operating room, if we can get them to the operating room that same day, there's nothing that prevents them from going home that same day. And if they feel up to it, I've had patients go back to work the next day.
Wow, that really is immediate gratification.
Yeah, for me and the patient.
Exactly.
No, absolutely.
So if there was anything else you would want the general public to know about the practice of urology, or things that they should be watching out for to talk to either their primary care physician or to make an appointment, what would those things be?
I would say if there's any issue that they're having that's different, anything that's new or different that just doesn't feel right in terms of urinary issues, whether it be women with urinary leakage, is something that we also treat. So if that's an issue, these issues that used to be really never talked about and embarrassing and people just lived with, erectile dysfunction, these are things that we talk about very commonly and very routinely and treat very commonly and very routinely now. So don't be afraid to reach out to your doctors. That's why we go to work in the morning, and have those things evaluated. Certainly if there's blood in the urine, or if urinary tract infections seem to be happening over and over again, these things need to be evaluated because there could be something underlying that's causing these problems. So by all means, don't be shy. That's what the medical system is there for. And the fixes are not anywhere near as ominous or as involved as they were a couple of decades ago.
Yeah, that's an incredible point, because so many times people just live with these things because they don't want to bring it up or they're embarrassed by it. Thankfully, I guess a positive side effect of all of the medical commercials on television now is you start to think that other people are going through the same thing that you are.
Absolutely. You might be too young to remember, but when Viagra first came out in the mid-90s, nobody talked about that topic. Nobody. And now it's just part of every night's television program.
Exactly. Every time you watch the nightly news, it's just all commercials about that.
Yep.
So, well, good. Well, Dr. Essig, I want to thank you so much for taking the time out of your busy schedule to come on and share a little bit about yourself and about your practice and all the services you provide to the Winter Haven community.
Thank you, and I appreciate your time as well.